Let's look at the concept of elimination, which represents mechanisms that facilitate the removal or excretion of waste products from the body. There are multiple systems involved in removal of waste from the body, like respiratory system, skin, and gastrointestinal and urinary system. However, in this chapter, we will focus on the elimination of waste in the form of stool and urine. Different concepts are associated with elimination and are represented in the model that you're looking at the screen right now. When you interview the patient to collect data about their health history, make sure to ask if they are experiencing any incontinence or leaking of urine. This can be a sensitive piece of information for patient to share, and many patients do not report incontinence unless asked about it because of embarrassment. Let's go over a few terms. Stress incontinence, which is most common type and is indicated by involuntary loss of small amounts of urine during physical exertion, such as coughing, sneezing, jogging, or lifting. Urge incontinence, on the other hand, is associated with a sudden, strong urge to urinate. And people can have both types of incontinence. When you're going over problem-based history, note that specific areas of assessment of the abdomen, GI system, and urinary tract include abdominal pain, nausea and vomiting, indigestion, abdominal distension, change in bowel habits, jaundice, and problems with urination. Old charts can be used for symptom analysis, especially with pain. Your textbook has a table on differentiation of abdominal pain in Chapter 13. Please go over that. Assess bowel and bladder function by asking pertinent questions. Become familiar with questions under problem-based history in your textbook, along with the rationales that are given under. Remember to start any assessment with identifying yourself, washing hands, identifying your patient, and noting any allergies when necessary. When using stethoscope, always make sure to clean and warm the head of the diaphragm before placing it on patient's skin. Your general routine for examination will include observation of patient's behavior and their position, inspection of the abdomen, auscultation of the abdomen, and palpation of the abdomen. Remember, inspection is a hands-off technique. It's not tactile. You are looking, not touching their abdomen. Always inspect before auscultation and always auscultate before palpating the abdomen so the presence or absence of bowel sounds or pain is not changed. When you're doing inspection, inspect the abdomen for skin color, contour, symmetry of the abdomen, any surface characteristics, or any area of pulsation. Skin color for a patient from different ethnicity may be noted as skin color appropriate to patient's ethnicity. Surface should be smooth. Any striae, scars, piercings, or tattoos should be noted. Make sure to assess the skin around piercings or tattoos for any inflammation or signs of infection. Contours may be described as flat, rounded, or scaphoid. If any abdominal distension is noted, use measuring tape around the abdomen to measure the abdominal girth. This will provide an objective measure to assess the increase or decrease in abdominal distension. Inspect abdomen surface for movements. Upper midline pulsations may be visible in very thin patients. The abdomen should move smoothly and evenly with respirations. And this might also be a good time for you to count the patient's respirations without them being aware that you're counting the respirations along, as you're inspecting their abdomen. Auscultation. So to auscultate the abdomen for bowel sounds, use the cleaned and warmed diaphragm of your stethoscope and press lightly. Make sure to listen to all 4 quadrants of the abdomen. We disagree with your textbook when it says listening in all 4 quadrants of the abdomen is not necessary. So please do listen to all 4 quadrants of the abdomen. Start by placing the warmed diaphragm of the stethoscope gently in one quadrant and proceed clockwise. All bowel sounds are high-pitched gurgles or clicks that last from 1 to several seconds. There are 5 to 30 gurgles per minute, or one sound every 5 to 15 seconds in the average adult. These sounds indicate bowel motility and peristalsis. If no sounds are audible, listen for up to 5 minutes. If bowel sounds are absent, make sure to notify the patient's physician along with documentation of the finding. Bowel sounds may be hyperactive at a point above a partial bowel obstruction, or decreased or non-existent below the point of obstruction. Hyperactive sounds occur more than 30 gurgles per minute. Decreased bowel sounds or hypoactive bowel may occur with ileus or peritonitis. High-pitched tinkling bowel sounds indicate intestinal fluid or air under tension in a dilated bowel. If bowel sounds are sounding normal, document them as bowel sounds present in all 4 quadrants and that they are normal active. So become familiar with these terms. They are not given in your book. When you palpate the abdomen, palpate it lightly for tenderness and muscle tone. Always warm your hands before palpation. You may ask your patient to bend their knees to relax the abdominal muscles. Palpate all quadrants of the abdomen. Use the pads of the fingertips to depress the abdomen about 1 centimeter for a light palpation. So for this classroom setting, we will be doing light palpation, not deep palpation. Some people are very ticklish, and some nurses use a technique by sliding their hands into each palpation to reduce that ticklishness. Another approach is to have the patient place his or her hand atop the nurse's hand as all quadrants are palpated. Ask the patient to breathe slowly for muscle relaxation. Your textbook goes over bimanual technique to palpate the abdomen, and you will see that in our videos too. Expected finding would be non-tender abdomen, but do look for any facial grimaces during palpation that may indicate areas of pain. If a patient has reported abdominal pain, palpate over the area of pain last. Please watch the video for GI assessment, and we will practice it in the lab too. So Sirat, I have a few questions about your GI-GU system. First of all, I'm going to start with asking you a few questions, then I will be doing some assessment piece. When was your last BM, your bowel movement?
This morning.
This morning. Do you go daily, or is it every other day? What is the pattern like?
Normally it's daily.
Daily? Okay. Have you noticed any change in your pattern at all?
No.
No? Okay. And how about, like, can you describe your BM for me a little bit?
Just normal, solid, and firm.
Kind of formed. Do you have any diarrhea?
No.
Or have you noticed any constipation?
Mm-mm.
Okay. And what about urination? How often do you go daily?
4 to 5 times a day.
4 to 5 times a day? Mm-hmm. Do you drink plenty of water? How much water do you drink usually?
1 to 2 liters.
Okay. It seems like you could do a little bit better on that one. Yeah. Have you noticed any changes with your urination, like painful urination?
No.
Any burning or urgency when you urinate? Okay. Can you describe the color for me?
Usually light yellow.
Light yellow? Okay. Now I will be checking your abdomen area. Okay, so I'm going to have you lift up your t-shirt for a little bit, not too much, but just, okay. I will be, without touching anything, I'm just kind of looking at the area now. Abdomen is slightly rounded, looks smooth, and I notice a small mole on the left upper area. There, have you always had that, or is that something new?
I've always had that.
Okay. Have you noticed any changes with that one?
No.
Okay. So patient states that they have not noticed any changes in that mole, but I would kind of keep an eye on it. Mm-hmm. Okay. And I do not notice any piercings, tattoos, no rashes, just a few spots of discoloration. Is that normal for you? Mm-hmm. Okay. Now I will be listening to 4 different spots okay? And my stethoscope is might be a little bit cold. I'll try to warm it up. And afterwards, I will be doing some palpation with both of my hands, okay? I will be pressing down in your abdomen. Do you have any pain in your abdomen area?
No.
Okay. If you had any pain, then I will be assessing that area last, okay? I will be listening to 4 different spots, as I said. If I do not hear anything at any spot, then I will be taking longer than usual. So bear with me there. Okay. Okay. Bowel sounds are present in all 4 quadrants, and they are normoactive. Okay. So now you will be feeling my hands. I'm going to try to warm them up, and I will be, as I said, like I will be doing light palpation, pressing down a little bit with both of my hands at the same time. It's called bimanual technique. Okay. I'm trying to notice any bulges or any issues there. Okay. And I do not notice any pulsations at this time when I'm visually assessing, okay? My hands are cold, apologize. Okay. I did not notice any bulges, no masses noted, and I was looking at your face at that time too to make sure that you were not hurting and not telling me, okay? So that completes that piece of assessment.